Madam Speaker, I rise today to share with you a story from Colorado of a resident of Lafayette. He's the president of a nonprofit statewide organization, operates across several states, well-known organization based in Boulder, Colorado, an organization with a philanthropic mission of promoting access to good education for the citizens of the western United States. They do good work, and I attest to that, having served on the Colorado State Board of Education and worked with them and many others in the education community. He writes that in 2000 his organization was paying $11,150 a month for their share of health care costs for their roughly 40 employees. Today, the organization is paying $24,500 a month. 8 years, it's more than doubled. And, he adds, this buys less health care because they've had to reduce the breadth of health care over spending twice as much for less. Sound familiar? I hear this story from hundreds and hundreds of businesses, of nonprofits, of individuals. It's getting worse, folks. The cost of not taking action means that 10 years from now, we'll be asking ourselves again, why did it double in cost? Why are we getting less for twice as much? For organizations like this nonprofit, as well as other nonprofits and for-profit organizations and small companies, it's critical that we pass health care reform, rein in growing costs, give small employers access to exchanges that give them the same negotiating leverage that large corporations have a public option that provides real competition with insurance companies, make sure that no one is forced to choose between one or two providers in a monopoly or a duopoly. Let's empower consumers with choice and let them choose the insurance company of their choice. By creating that market dynamic, we can rein in growth in health care costs and make sure that organizations like this one won't be telling the same story 10 years from now. Thank you, Madam Speaker.